All right. So, hi, everyone. Welcome. As you know, we love to host these podcasts with some of our best alumni and some of our trainers, even to kind of share their wealth on this amazing journey that they've taken into aesthetics. Joining me today is Dr. Jarrod Cornehl, who I've actually known for over a decade. He's been one of our alumni. He's a member of the International Academy of Facial Aesthetics, but he's done quite a bit. He's taken this to a whole new level from not just practice, but also teaching. And I'm proud to say he is now part of our own faculty team. So we're very excited to have him on so many levels. Welcome, Dr. Cornehl. How are you?
I'm great. Thank you. So good to see you, Anna. And thank you so much for having me on the Dental Injector Society podcast. I'm excited to be here.
We're excited
So
to have
yeah,
you.
yeah. Things have been great. Thank you.
I know. So I can't believe we met in 2013. I was looking back. I'm like, Jesus, where does time go? It's like 12 years now.
I know.
And you've done a lot since then. So tell us a little bit about your journey.
I have. I've been practicing dentistry for 23 years. So I graduated in 2002. I'm a restorative and cosmetic dentist, and I'm the owner of Dental Studio SF in San Francisco, California. I actually landed in aesthetics back in 2008, so
Very
17 years
beginning. Yeah.
ago.
Yeah.
I was going through what I will call my first midlife crisis. And one morning I woke up and I looked in the mirror and I could see lines and wrinkles. I could see my crow's feet. And
Oh,
I thought, no,
more
no, this
personal.
cannot be. No, no, no. So I immediately got on the computer and looked up, the closest and the soonest Botox course I could find for facial injectables. I needed to learn this for not only myself, but actually my friends and family and colleagues were also asking for this. So yeah, that's
At
how
that time, did you know you were actually going to integrate it, or was it just personal?
it was completely personal at that time. It was solely so I could look fresh and not start looking my age. I've been kind of blessed with genetics and I've always looked younger for my age, but I was starting to look my age. And so I did not like that. So I did it for personal reasons at first.
So how did you get to when did you start taking courses?
Yeah, so that was my first intro to botulinum toxins, and my journey is kind of interesting. So I would just dabble in that for the next few years. And that training not only got me into aesthetics, but a few years later, I kind of just fell into TMD pain management as well. So once I started learning TMD, that's when I started offering that to my patients. I happened to be at a dinner party with a bunch of friends, and one of my friends, she told me, "Hey, Jarrod, I am overdue for my Botox treatment. My migraines are coming back." And I looked at her and I said, "You have migraines? I never knew you had migraines." She said, "Yes, ever since you've been treating me for aesthetics and my glabellar lines and forehead lines, I noticed I get no more migraines." So looked at her a little perplexed. I didn't understand that connection at that time. And I would spend the next few years figuring that out.
Yeah.
And so once I did, I ended up starting to offer these procedures into my practice. I also then wanted to get really good at it. And so I actually found DentaSpa Seminars back, like you said,
It
I think
took
it was
all
2013.
it took all of our courses back then.
Yes, it took all those courses, I think starting back in 2013. And I'm the kind of person who I need to be, I need to know exactly what I'm doing before I start offering it to other patients, paying
Right.
patients. And so I would take over time thousands and thousands of hours in aesthetic injectable trainings and really got into it. I could really see how this can complement our dental procedures, our comprehensive dental treatment plans that we're coming up with our patients, whether we're just doing some bondings or Invisalign, moving their teeth, but we could also now help fix asymmetric smiles and thinning lips, etc. So the journey was very natural to me. I started telling people that I did teeth, smile, and total facial aesthetics.
Yeah. So that's a great point that you're making because I think a lot of the times some dentists see that right away. They see the correlation and they see how easy it is to, unlike other specialties in medicine that really have to create some, what they're doing is not directly in the face or it's not related. But with dentists, they are already in the smile. Most of the treatments we do anyway with these is right into this whole perioral area.
Yeah.
So it's like a natural, so what would you say about that to dentists looking and seeing like, oh, how do I integrate that, right? Like what's your advice on that?
Yeah. So I would say, for sure, dentists need to integrate this. We have this great advantage. We have this comprehensive dental training that gives us an extensive understanding of the intricate anatomy of the head, neck, and face. And it sets us apart in the field of aesthetics. We can deliver precise, effective, natural looking results for our patients. And I'm a huge advocate for dentists adding these procedures to their practice. We're good at it and patients trust us. And so it's just a natural progression of doing cosmetic or just dentistry in general.
What are the first treatments? Because now you do it all under the sun, and I think it's beautiful because you really can approach this from a combination therapy standpoint. But what were the first, what were your entry into this? I know you're in California, now you're based out of both, which is amazing. But what would you say like the dental applications make a big difference in kind of opening the door to all of this? Or did you kind of just do it all? Like what kind of flourished first?
Yes. So, like I said earlier, I really started offering this to patients who had TMD. And so I think it was easier to integrate with dentistry and in the smile zone at the beginning. I would absolutely recommend everyone to start doing this in their practice, but they need training, right? They need to be able to remember that knowledge that they learned a long time ago in dental school so they could add these procedures to their practice. The reality is patients are already getting these procedures done. Why not get them from you? They trust you. As dentists, we give the most injections in the face every day. It just so happens to be in the mouth. So we already have this knowledge and this skill base. So it's just a natural progression. And this is, and it's so convenient also for patients because they're already coming into your practice. They're getting their teeth cleaned by the hygienist, or they're coming in for filling or what have you. And do you know how many of my patients will, check in and stop at the front desk and ask, hey, does a doc have time to do my Botox today? And, once you've had that consultation and created their treatment plan or their recipe for their injections, they don't take long at all. The
Right.
patient benefits, and so does the practice. You just increased your production for that hour in hygiene. And it's a wonderful practice builder.
So what do you think are the biggest advantages when it comes to adding, for dentists, specifically adding botulinum toxin and dermal fillers and other things into their practice?
Yeah, the biggest advantage is convenience and trust. They, like I said earlier, they already trust you, and and we are, dentists think in millimeters. We're very precise, and so we're very good at it once we get training. And I think it's just a great revenue. It's a great source of revenue for our practice to start building up production in other avenues instead of just restorative dentistry or
Exactly.
orthodontics. Now you've got aesthetics or even TMD. So
Yeah.
it's many different avenues of production for your practice to grow.
Yeah, that's actually a point that I wanted to ask you about. Do you see that we all know that there's far more greater revenue producers in a dental practice. However, what I find a lot of our alumni say is that dental injectables really creates a whole other level of referrals to dentistry. So do you see this coming back and forth where now you've developed the new patients and then now they're more willing to do some of the high ticket items in dentistry?
Oh, yes, absolutely. It started first with not even having to do marketing because you've already got these active patients and you have your practice and you start treating them and all of a sudden, so now they're not only a dental patient, now they're an aesthetic patient. And now they're talking about this at a dinner party with their friends and they send over, their friend or colleague or family member to do just aesthetics. And so we do their aesthetics, and our goal is obviously to convert them to a full dental patient as well. So
Right.
they work hand in hand. So you can grow your practice both ways very easily by adding injectables into your practice.
Yeah, one of the things that's exciting that we haven't had, because like you, I've been putting these programs on in the dental world since 2006, under DentaSpa brand 2010, but since 2006. And over the years, we've been waiting and waiting and waiting. And every course or every other course I get asked, "Hey, Anna, what are the dental codes?" And now we have them. We finally have dental codes for neuromodulators and dermal fillers. What are your thoughts on that? Isn't that exciting?
Yes, it's very exciting to finally have, true ADA codes for these procedures. There's still there's still an out-of-pocket expense because the dental insurances have not come around to paying for these procedures. They're elective, right? But it's great that it's helping to open the door for aesthetics in more states for more dentists to be able to provide these procedures in their offices.
Yeah, and I do see, kind of like other treatments in dentistry that also were out of pocket, like, but then eventually they did get some level of coverage depending on the type of insurance. That's the gateway to maybe some of them, some of the better insurances covering parts of certain things and such. But yeah, it's exciting to see where that has gone.
Yeah, and I think it's two now dental schools are now offering facial aesthetics as part of their curriculum. That plus the ADA codes is sure to help bring those other states along that have not incorporated into the Dental Practice Act.
Yeah, and even those that universities that aren't, I mean, we are partnered with so many across the country. Not necessarily, so they see the value, even if it's not in their specific curriculum. They have kind of partnered with us, like University of Florida. We do for, I think, since 2015. Yeah, 2015, we've been offering um every year we do one for the graduating D4 students. So they're already coming out with this knowledge. So it's just such a great time now for dentists because it's so accepted. There's codes, there's, for a long time now, and malpractice allows you to add it without any additional. I remember in the beginning, people used to have to get a whole different malpractice just for these
Right.
treatments. And so it really is exciting. What would you say is in your, one of the things I find is in the beginning, dentists will kind of get fearful of integrating certain treatments. Some are more comfortable with botulinum toxin and then they go into dermal fillers. But do you feel that a lot of people will say that you can't do one without the other if you're trying to run a whole thing. And I think you probably get that the most because you've kind of integrated all aspects of aesthetics, PDO threads, PRF, and all of the things, because at the end of the day, you got to be able to serve your patients, kind of like in dentistry. You don't have one solution, you have various things that can come together, right? What are your thoughts on that?
Yeah, first combination therapies work better. Okay. So the more things we can throw at our patients, the different types of procedures, the better they're going to look. I started my journey with toxins, with neuromodulators, and it was just a natural progression to start adding more and more treatments. You cannot be a facial aesthetic expert if you only know one thing. So you need to start looking at adding a few other things because your patient is going to be asking for it. And I like that with DentaSpa seminars, you kind of walk them through the journey and step-by-step process on how to slowly start adding more and more procedures so that you can implement those in your practice. It's Botox is the gateway drug. So, definitely starting with that first, but then going on to volume loss and doing dermal fillers is next because patients are going to be asking for it. And if you have no idea what they are, don't even know the brand names, how they work, then how are they going to think that you're now the expert?
Right.
So make sure you get your training and follow logical order for it. You don't have to start all tomorrow with learning everything, but start with Botox and then eventually dermal fillers, PRF, PDO threads, etc. So you can become the facial aesthetic expert in your area.
Would you say, I asked this question and I think a lot of people respond with one common denominator. I want to see if you agree. They say to be good at aesthetics, you have to master anatomy, right? And so if you know anatomy, it's not just about safety, it's just being able to really understand how all this comes together. Would you agree with that statement?
100%. Anatomy is super, super important. I'm continually learning. I still
Cadaver
take anatomy
workshop.
courses and cadaver courses.
Yeah.
I take them every couple years still, just to stay on top of things and refresh, because I want to deliver the best, safest results to my patients. One of the first ones that I had done was at the IAFA, and there was a cadaver course there back, I don't know, over 10 years ago.
You've
And
done it every year since, and it's gotten really good. I mean, it's incredible. Dr. Terry Alford has really done the homework at all of the different ones around the world and brought back like such incredible things. We do it now with ultrasound as well. So we always recommend that, anybody that's really serious about their journey, that they come to that cadaver workshop that we have in November every year, because it's a game changer. And you're right. We have seen our best alumni take it several times for different reasons. Like in the beginning of their journey, they took it introductively just to kind of learn all the danger zones. Then they may be taking it because of PDO threads and their understanding of that. And so you kind of have this evolution of where it's working for you from different perspectives and from advanced perspectives, right? Because you've taken it several times, you were saying.
I've taken it several times. I mean, I've taken it so many times, literally every other year, probably. I'm still, even though I am, I would say I'm an expert injector and I've been doing this for a long time, I still go to courses where I learn and I'm the student. Not only am I able to learn more from my patients, but then I can bring these little pearls into the courses that I teach and to share that knowledge with others. And speak back to the anatomy, it's not just about what's in the textbooks. We can know where our facial artery is in a 2D plane, but where is it 3D? What level is it at? What level in the tissue where is it? Because that's going to help us provide safer injections for our patients, and maybe use different tools. Maybe
Right.
we're going to select a cannula over a needle in more risky areas. I think anatomy is super important.
Yeah. One of the things that I love about our faculty, and one of the reasons why I'm proud to have you on board, it's not only did you start your journey a long time ago, and part of your journey was with us, and you really took on, we saw your desire to really want to be the best at this, and you continued your journey. You're part of the IFA and you're a part of so many other academies. You've been teaching. And what I find in my 18, 19 years now of working with trainers is that not everybody has the gift of teaching, right? And not everybody, and I think that the best instructors that we have, whether they're at DentaSpa or they're supporting academy, the International Academy of Facial Aesthetics, is that they don't think they know it all, and they're constantly learning. They are constantly, just immersed in it, right? And so that's what creates a good teacher. And as we're, I already knew you were good and that you were doing that, but I had no idea just how much you had been doing. We see each other at least once a year at the symposium for the
Right.
IFA, but it's hard to catch up on everything. And as we're, as you're coming in to be one of our dental trainers, I find out you're even doing a master's in aesthetics. That's like aesthetic medicine. I mean, this is like amazing. So kudos to you for really taking on this incredible part of what is now, I would say it's part of dentistry now. It's the fact that you're doing this program is very exciting. When did you start that?
Yes, I started it last year. It's a 2-year distance learning program. It's to get your master's in aesthetic medicine. It's by Queen Mary, University of London. We don't have this degree offering in the US.
Okay.
But so I found this amazing program that I know lots of other of my colleagues have taken, or at least a handful of other colleagues have taken. And it just because I want to continually be learning and I want to be the best at what I do. And so, being on the stage and educating and lecturing around the US, I want to have some credentials behind my name. This guy obviously knows what he's talking about. He has a master's in aesthetic medicine. So I still got another year to go, but it's very rigorous. I don't know how people do it with families and kids, but it's a lot. It's a lot of reading, it's a lot of writing papers, a lot of quizzes, but it's fun learning and I'm happy to do it.
In school. So you're teaching and learning. That's what life's all about, right?
Exactly.
Um, so one of the things that we do at DentaSpa, and this, and we haven't sold out, is that we keep, the IFA is multi-specialty. It was once the International Academy of Facial Aesthetics, for those in the audience that don't know, is our supporting academy. Started off as a supporting academy for dentists coming out of DentaSpa, and after 2016, meeting some of especially Dr. Kian Karimi and these people that really came on board, and them really realizing things like cadaver workshops weren't really done as readily back then, that you had to go to Europe to get anything like that. And so for me, it was a proud moment because we were doing this in dentistry already since 2011 at dentists that were doing injectables, right? And so he took on and did this at the LAMCA. And so now we see this more prevalent, but back then this was something offered, in the dental community. And
Right.
I've just seen where there was so much resistance before about dentists. Now I see it's shifted where dentists are now accepted by other specialties as one of the collaborating, like you don't see any, or you see more and more, like in every conference, aesthetic conference, there's at least one dental speaker talking about things more related around the smile and things that are very much, part of this aesthetic world. So it's like everybody's playing in the same, sandbox and kind of getting along better, and seeing that there's a collaborative effort to really give education. And so, for me, the IFA, I would always put these top derms and plastics and DOs, and I would put like one head dentist or something like this because I felt that was what needed to come together. But that was kind of not as much as now. Like now, I see the LAMCA has a couple of dental speakers. And so it's just become more integrated and accepted, even from not just the patient side and the government and board side and all that stuff, but also from other specialties realizing that, this is a big part of how everything come together. You can't, there's such a big value of knowing dental structure and all of that when it comes to play with all facial aesthetics, right? Because most of the treatments again are right here. So
Right.
it's just a very exciting time overall.
Yes, I've loved seeing this. Europe or the rest of the world has always, the main injectors for aesthetics are dentists, like in Brazil and the UK, all over Europe. And it's taken a while for that to translate here in the US, but it's very exciting to see what you're saying. Now there's that drop down box that has DDS DMD on it. So we're not just other anymore, or if we're even allowed. So it's wonderful to see all these specialists from many different fields coming in and learning together. And it's only going to help make our results and help our patients in the long run.
Absolutely. There are even a few states now that are allowing dental hygienists to inject as well under the supervision of a dentist. So that's exciting too. So
Right.
we're just going in the right direction. And I know even in California, one of our dental trainers, Dr. Perez, said that there's been finally a movement and change within the board. They're not as crazy and, knocking on doors, when things are, so it's a little bit more laid back, and hopefully we'll see the progression like other states have done, like Arizona and Nevada, where they allow full cosmetics, therapeutics, and, as long as you've met criteria, which is what's important, right? As long as you've taken a reputable course. At DentaSpa, one of the things that we've maintained is the integrity of always having a mix of very experienced medical trainers, nurse practitioners, PAs, whatnot, that do this day in and day out. This is their world. They teach, a lot of them teach for Allergan, Galderma, et cetera. But in every course, we never do a course without a dentist, because we feel that there is a value that comes, especially as you said, the dental applications is critical. So we start our course has what a medical program would have in terms of entry-level Botox and fillers, but we also do the whole component for TMD, facial pain, and gummy smile, because you can't, walk away without that from the beginning. And it takes a dentist that's experienced, that's really in the field, to really bring that about. And that's, even though you do it all and above the sun, like everything under the sun, like I really was attracted to the fact that you started off really with the TMD world and the therapeutics, and you expanded into all these other avenues. But that's kind of what you really owned and you've really taken in. And so I know you're going to have a lot of value in our courses now when you teach for that area. So we're excited to have you.
Yeah, I'm very excited myself. Thank you.
So I want to jump into a topic which is, I think, has been growing in the world of aesthetics, but also in dentistry, PRF, right? Platelet-Rich Fibrin, PRF gels. Tell me what first got you into that. And I know you've done some exciting things, so I won't take, I know about them. So share with me on how that world came about.
Yeah, absolutely. First of all, dentists have been using platelet-rich fibrin for years. In fact, every advancement in PRF has come from dentists. We use it in surgery for wound healing, treating periodontal defects, bone grafting, sinus lifts, etc. And, over the years and learning more and more about the uses of PRF, naturally have me looking at aesthetics. And, there's a lot of patients as well who are looking for all natural regenerative results. They don't want to look overdone or puffy. They're scared to use synthetic materials like hyaluronic acid fillers. And so we can, use platelet-rich fibrin and take the body's natural regenerative potential from their blood and concentrate it and inject it back into the tissues for skin tightening, reducing fine lines and wrinkles. We use it as biological fillers, like you said, or as in a gel form to build volume over time, and just overall get amazing facial rejuvenation all naturally. So I'm sorry, go ahead.
Oh, go ahead. You what?
So I started with PRF. I've never done surgical procedures in my practice. I was always restorative and cosmetic dentist, and sent all of the surgery to my specialists. But I knew about PRF a long time before, but I didn't really know about the facial aesthetic applications until 2017 or 2018, when I started learning about it. And I started learning about its use first with just some very simple skin rejuvenation with microneedling with PRF.
Yeah.
And from there, I wanted to learn more and more and more. And I think it was at an IAFA conference back in 2019, 2020, when I met someone who was speaking on PRF and knew everything, kind of the godfather of platelet-rich fibrin. And I had to know more. So I looked into taking more courses, and eventually, now use it every day in my practice for all natural rejuvenation, for its regenerative potential at skin tightening, reducing fine lines and wrinkles, and using it as a biological filler to replace volume loss, where we once had volume and we've lost it over time. And so I love using it. It's a great product, and it just comes from a simple blood draw. So we grab our patient's blood, we spin it down, and we super concentrate the cells, and then we use it all naturally as a rejuvenation for our patients.
So you're saying would you say there's a rise in regenerative aesthetics? Would you say that you've seen that trend happen in your practice a little bit, where people are more inclined, from what I've heard, it had its rise and then it kind of fell off, and now it's like really like things like Sculptra, PRF, exosomes, all of these regenerative therapies are really taking. Do you see that in your practice? Do you see it
Yeah, absolutely. PRF and all natural regenerative treatments are the future for sure. I see it a lot in my practice, and even in dental practices already using PRF in the surgical world for extraction sites and sinus lifts. You draw the patient's blood, and then the patient starts asking, "Hey doc, can you draw up a little bit more and use it on my face? Can you do a vampire facial? That's all they know. Can you inject it into my fine lines and wrinkles?" And the same thing happens when we're doing it for TMD, for therapeutic Botox for TMD pain management. Hey
Okay.
doc, can you pull up a little bit more Botox today and treat my frown lines and crow's feet? So they're already getting it done down the street. So why not make it convenient for them, help them look better, feel more confident, and increase your bottom line at the same time? So it's definitely the future. Absolutely.
PRF, wonderful for so many things. I want to ask you a couple of questions. One is now PRF being used also to help with TMD?
Yeah, absolutely. So, TMD, if I can make it very simple, we have two broad types of TMD, those involving muscles and those involving the joint. So if they have true joint problems or intercapsular disorders, we can actually use platelet-rich fibrin and inject it intracapsularly to help reduce their pain, reduce popping and clicking, increase their range of motion, help repair torn or lax ligaments. And so we get the body's all natural healing pathway happening, and we get these amazing results for people with true joint pain.
Wonderful. So yeah, so when, in all of our courses, we do a very intense look at why the why behind the pain and the why behind, so that you really know what's going to be the best application. And anytime it's muscle related, we know botulinum toxin is the way to go. But now we have another source to also help when it's not muscle related, right? So that's
Right.
wonderful. Well, I look
Exactly.
forward to you because that would be a part of our level 2. I think that's going to be exciting to have that evolution where they're learning the muscle components and TMD and facial pain, and then in D2 looking at other ways to kind of solve some of these issues and pain related issues in that area. That's exciting.
Yeah, it's very exciting because a lot of people just learn how to do TMD Botox,
Mhm.
and that helps for the muscle pain, but they still might have residual pain in the joint. And so it could be a true joint problem. And so we can use PRF in the joint, and it really helps bring our results to that next level for our patients.
Do you sometimes see the use of both in combo, that you need to do both on a patient? You need to relax
Yeah,
and do the ligament?
yeah, absolutely. It just really depends on what the patient's presenting with. Most of the time, by far, muscles are the most problematic. And, someone might even, you press on their masseter or their sternocleidomastoid mastoid, and they may say, "Oh, I notice joint pain." I take that with a grain of salt, because more often than not, it's a trigger point that's got referred pain to the ear or joints area. And so I like to take a kind of a two-step approach to it. Shut down the muscles first with botulinum toxins, have them come back a few weeks later, and then reassess, is that joint pain still present? And then evaluate, did I treat all the muscles that could be causing the referral pain, or is it a true joint problem and an intracapsular disorder? And if it is, then we can use PRF in the joint. We can use it as a liquid or in the gel form as a biological filler. And we can slowly release those growth factors over weeks to months, depending on what we're injecting, and they get that benefit of healing over that time frame.
Nice. So one of the things that I always assume people know this, but I was asked by 2 dentists at our course yesterday about this. He was asking about PRP courses. I said, well, we used to do PRP courses, but now with the studies that are out there and effectiveness of PRF over PRP, we now focus on PRF. So explain to our audience who are new to this, just briefly, like, why would you want to learn to do PRF over PRP?
Yeah, well, a few reasons. One, PRP is technology from the 80s. We have better technology now. Why would we use something that's less effective when we can get 4 times the platelets and leukocyte concentration in platelet-rich fibrin? That's 400% more growth factors that you're delivering to your patient. So that's number one, right? As dentists, right, we all know we don't use first generation bonding agents anymore, right? It's evolved over time. So we use the latest one. And so PRF is the latest and it's superior. Also, it is 100% autologous. So there's no chemicals in the tube at all. It's only the patient's blood. If we think about the natural pathway of healing, let's say you're in the kitchen and you're slicing up cucumbers and you cut your hand. Well, you start to bleed, and the first step of healing is coagulation. So if we have anticoagulants in the tube, we can't even do the first step of healing because there's anticoagulants. So that's another reason to use platelet-rich fibrin. It's all natural.
Free of
And
anticoagulants, yeah.
yeah,
Why did
absolutely.
we ever add that in there?
Well, we didn't know back then, the science, we didn't know. We thought that if you didn't put the anticoagulants in there, that the blood would clot too soon. But we've got machines to, the tube technology is one. So we make hydrophobic tubes so they're less likely to clot. We also can put them in a cooler so they clot slower. And so, we're not exposing it to oxygen until we're ready to inject. So all those things can help extend the working time of platelet-rich fibrin. There's plenty of working time, plenty.
Yeah, I always like, I always like to say that because sometimes there's the thought that, but people have come up with the right tools to be able to utilize it, to keep it, from to the little coolers that Cosmo France has and all that. Those are all great and help us in the courses, because that was one of the hesitations for us too, from a program standpoint. But for many years now, we've been doing PRF in our courses. And I have to say, one PRF treatment equals 5 PRP treatments. So I was like, what? You're right. It's like,
Yeah. I mean, PRP, people still are stuck on it because they have their old machine, they're used to it. It works. But it doesn't work as good as the latest, platelet-rich fibrin. So, come on, your patients deserve better. So let's give them 400 times more growth factors and bring those results to the next level. You're going to have to do less treatments, and it's going to cost the patient less in the long run, and they're going to be happier, and they're going to send you a bunch of patients in return. So it's just a win-win.
yeah, well, happy patients, but also happy doctors. Let's talk a little bit about how profitable PRF can be compared to when you have to buy, a $200-300 syringe, and yeah, you sell it for $750, whatnot. Botox is great as the gateway, you 100 to 150% markup. But tell me about PRF and the profitability there.
Yeah, it's huge, right? We're not paying for the filler product or the toxin. You're not giving that profit that should be yours at the office to a pharmaceutical company, right? So you're getting the blood from the patient. That's free. It just costs you some tubes, so it's not a lot. Once you've bought your spinner to your centrifuge, the cost per treatment is so little that it's almost all profit to the practice. And it's all natural, so patients are loving it. And there's a big market to market to these patients who are looking for all natural facial
Yeah,
rejuvenation.
those
You get different revenue sources from patients coming in, those that are seeking Botox, those that are seeking all natural. And so it's a great way to increase the bottom line of your practice as well.
Yeah.
And it's so much cheaper, right? It costs nothing almost compared to, Botox and fillers.
Would you say it's also a good way to introduce it to people that are hesitant to go first to Botox and fillers, and then once they've kind of integrated. They love the PRF. Sometimes they're open to accepting more that, because obviously muscles are targeted with toxins, and there's limitations to what PRF biofillers can do. Maybe they do need like an actual filler or a Sculptra or something different. Would you say that PRF for those types of patients, it helps open up that gateway to all the other avenues of rejuvenation that they have?
Yes, absolutely. So even those patients who want all natural, results and to use all natural products, as they're coming in, getting their treatments, we're constantly talking to them about, improving their results with combination therapy. And so
Right.
once they understand that, one treatment one time is not going to work, a lot of patients think that, oh, I'll be good forever. And I like to tell them, well, can you go to the gym once and look amazing? No, it's a lifelong journey if you want to stay looking good. So same with Botox fillers or PRF. But so those patients that are doing platelet-rich fibrin, we also talk to them about how we can improve their results, because while we can help with the fine lines and wrinkles in their skin around, their crow's feet or glabellar lines or forehead lines, if we're not shutting that muscle activity down, those lines and wrinkles are going to come back faster. And so we're increasing the longevity of their results. And anytime we can do more than one treatment and combine them together, like PRF and lasers and toxin, then their results are going to be way better.
You're absolutely on point there. And again, going back to PRF is something that leaves your skin glowing after one, and so repeating, like, it makes you want to repeat it. Whereas when I first, many moons ago, over 10 years ago, was doing PRP, you don't see the same results. So you're like, and then you fall off and you don't do it. But when you're doing something that immediately gives you a beautiful skin glow, you're going back and actually doing it 6 weeks later or whenever it's recommended, right?
Yeah, absolutely.
Yeah, PRF is something that I've become very much in love with these days. It just changes skin integrity. And you're right, like, if you can't just do one, one targets muscles, one targets volume, one targets skin texture, and also a little bit of volume through some of our instructors, or almost all of them now, they won't do, including Shinobe, he's like, under the eye PRF biofiller, you can't, like it's just, you can be the best injector in the world, a filler just can look weird. And so doing a PRF biofiller is going to, has been now by a lot of experts, the true
Yeah.
solution for that area.
Absolutely. I was actually just going to say that I could not practice without it. I've changed the way that I practice with platelet-rich fibrin. The under eye area is a very difficult area, and you can make someone look a lot worse very easy. And if don't inject enough product, or if you inject too much, or if it's the wrong type of hyaluronic acid filler that brings too much water, they can look really puffy and have bags under their eyes. So for me, I'm always starting with PRF under the eyes. If they've got volume loss, we're using biological filler or biofiller deep under the muscle, followed by a liquid PRF above the muscle for the skin rejuvenation and tightening effect. And the patients need to know, that it's going to take a couple visits for that to work, because it's regenerative. I also tell them, look, this is like planting a seed or fertilizing. So we're now planting this seed there, and we got to wait for the body to do its thing and generate that tissue there. So they're going to look good immediately, but a lot of that's going to go away because it's more water. And now we're waiting for that regenerative potential of the platelet-rich fibrin to do its thing and slowly grow tissue over time.
Right. I know everybody's pricing is different in different states, but can you give me like an approximate? We know that the costs are very small. Like, I would say one of the companies we work with, you keep it under $150 for the kit and everything to do all of that. It's under 150. That's an approximate. Some are more, some are a little less. It just, you can make it really cost effective. But what are you charging for a microneedling PRF, and what are you charging for PRF biofillers? Like, what would you say is an approximation of somebody coming in to do their face or face and neck?
Yeah, so if it's microneedling, we are charging $1,800 for 3 sessions.
Okay.
Okay, because
Package.
they need to pay for that upfront because, like you mentioned earlier, you may not see the result within that first session. So we
Mhm.
get them back about 3 to 4 weeks later. That's when their collagen and elastin are on this upswing. Then we hit them again, then we hit them again. And so then they get these amazing results because if they don't see any results the first visit, they're simply not going to come back for their second and third. So we
That's
do
a
a
good
package
point. That's a good
for
point.
their micro needling, and then their maintenance sessions become $700. Okay.
Okay.
If we're doing platelet-rich fibrin underneath the eye for tear trough correction, we charge around $800, okay, for that treatment. So about the same that you would charge for your syringe filler, but the profit margins are much higher because
Much.
we're not making the pharmaceutical companies richer. We're helping increase the bottom line of our practice. And then,
Absolutely.
if we're using treating, you could do it by area and charge, somewhere between $700, $800, $900 per area. You could do pan facial rejuvenation and charge a fee for, drawing more tubes, spinning more tubes down and treating them more holistically. And so it really
Right.
depends on what you're doing, but you're charging it similar to your injectables, but maybe a little less because it costs you less, a lot.
Right. What would you, going into, just, I want to ask you about the dental therapeutics, right? So when you're talking about facial pain, TMD, gummy smile, what else do you do? Or like, what would you say would be the evolution on an advanced side of things? Like, do you get into, uh, the back here, take, temples? Like, tell me a little bit about all of the dental applications that you think are essential in dentistry.
Yes. So, a lot of people think that TMJ Botox is just masseter Botox.
Mhm.
But we know that we've got three primary muscles of mastication. We've got our masseters temporalis and medial pterygoid. So we want to shut down two of those, the masseters and the temporalis, because if we don't shut the temporalis down as well, it just becomes hypertrophied. It becomes stronger. People start getting temporal headaches. So at
You
minimum,
Do you always do both?
always do both together because if not, those other problems happen very quickly in almost everyone. So, it should be at minimum TMJ Botox should be masseter and temporalis Botox. But then once you get into it, you start treating more and more patients. You learn how to integrate trigger point injections, laser energy for photobiomodulation, and other head and neck cervical muscles. There's the main muscles that are affected that are causing patients TMD or oral facial pain are masseters temporalis, splenius capitis, sternocleidomastoid, trapezius. So learning how to treat those muscles is key because you can really bring your results to that next level with your patients. Yes, they might be way better with just, here, but they're still, they're always saying, but gosh, I still have this pain here, or I still have this pain here. And so by learning how to treat those muscles with toxins, with laser energy, with trigger point injections, really, really helps benefit the patients.
Right. So all of this area is considered part of the neck area. So
Yeah,
we,
yeah, head and neck, collarbone and above, basically.
yeah, and that's exactly how we do it. In D1, we cover masseter and temporalis. And in D2, we move into further down and doing the trapezius and all of that. So yeah.
Yeah, yeah, it's perfect. So it's just a natural progression. So they're going to learn, also for dental therapeutics, like you said, gummy smile for sure, downturned corners of the mouth, the angular cheilitis, maybe helping with asymmetric lips or thinning lips, or just dehydrated lips in general. Those are some procedures we do all day long in as far as part of their comprehensive therapeutic dental treatment plan.
Yeah, and what's exciting is a lot of these treatments have a duality, right? Like, and dentists have the ability to present them as such, because if they're doing TMD, they're also able to help with facial slimming and, in different areas where they're able to do, you know, um, address something that may be therapeutic, but also from a cosmetic standpoint, right? Because we have that duality, and even areas where you kind of want to, you mentioned some of these earlier, where you want to kind of do two things in order to elongate the result of something else, right? Like when you were talking about the crow's feet, yeah, we can help the already existing static lines, but why not also address the dynamic lines? And similar to down here, yeah, we're going to fill all the lost volume, but are you going to keep breaking it down with that heavy DAO? We're going to not. So there's all this combination, that comes into play where knowing all these different avenues of treatment are going to be overall better for the patient and optimizing care.
Yes, absolutely. And, I would encourage all the dentists, even if they are saying, I'm only going to do it for therapeutics and treat TMD, you really need to learn the aesthetic zones as well. Because, back to my friend at the dinner party, I wasn't treating her masseters and temporalis. I was treating her glabella and forehead and crow's feet. And, this is a migraine center, the glabella area. And if we look at anatomy and if we start knowing our nerves and structures, we know that our trigeminal nerve, V1 and V2, are going all through those muscles. And while we are, if you're not able to treat their pain fully and get rid of all their headaches, maybe they've got migraines or frontal headaches or behind the eye. So you need to know those zones because those zones will take care of those problems, but they'll also make them look better. And if you don't know how to make them look better, you're going to end up dropping their brow or dropping their eyelid, and they're not ever going to want to get injections from you again. So they really go hand in hand, the therapeutics and the aesthetics. And so you really need to know both because you can really help those pain patients. Even though you're treating them in aesthetic zones, you're doing it therapeutically, but they happen to start looking better, right? So
Absolutely. And as we know, we found that even when you're just doing it aesthetically, sometimes there's a coincidence the other way around. We're like, wait, I used to get headaches. I thought those were normal. And so that's the beauty of it. So, and last to close off, I want to, there's people listening that most of the people that are listening are trying to get inspired. They're maybe thinking about taking courses. What would be like your biggest advice in terms of, what are the steps that they should take to get started? Tips,
yes.
anything that comes to mind.
Yes. Well, you know what? Start signing up for a course, a foundational course like D1 with DentaSpa. It's perfect. And you just walk them through the steps on how to start increasing the procedures step by step. It's perfect. So I really love the training with DentaSpa Academy and the D1 that led to D2, etc., because they're small group courses. There's always a dentist there. We speak the same language, right? We have the same jargon. Um, you learn from these amazing trainers that are so personable and just super friendly, and you become friends with them for life. And so that's great. But really, you get this, this nice hand holding that I feel like a lot of people need at the beginning. It's a little odd to inject outside the mouth at first, and it's a little scary, but it just something will click after a few times of doing it, and it just becomes so natural. I mean, we're so good at hand skills and just minute movements. Like I said earlier, we think in millimeters. We are so good at this, and you just got to start by looking online and start signing up and get trained, and then start using those skills on Monday morning when you get back.
That was what I was
If
going to
you
touch on.
don't, uh, you're going to lose it. And so you need to have, bring your team, have them know how to reconstitute the toxin, bring your front desk so they know how to answer the phone for you. Someone needs to set up your accounts with the injectable companies like Allergan or Galderma, et cetera. So, if you're taking months to set up even an account because you can't order your toxin, then you're going to lose all those skills. So you need to, set that up, come to the class, and then just continue your education journey. It's not, aesthetics isn't like a dental course where you could go and learn about this new bonding procedure. You could probably go back to your office and do it, no problem. not even think twice about it. But with aesthetics, you're learning the aging process, you're learning about skin, you're learning about muscle dynamics. And so there's a lot more to learn. So it's a journey. And I would just encourage anyone to start that journey sooner than later before you get left in behind, because the other practices in
They're
your
all doing
community,
it.
they're doing it. And
Yeah.
your dental patients are going to end up in one of those offices, and they're going to get talked into staying there so they can have their aesthetics and their dentistry done at the same time. So
That
I would
is
encourage you not let that happen.
Well, this was absolutely wonderful, Dr. Cornell. Thank you so much for your time and your insight and your inspiration to others there. I'm excited to be working more with you now. You've been a part of our crew at IFA and for so long, and it's exciting to know that you're going to now be sharing your knowledge, not just what you've had for since 2008, but everything you're learning new as you're taking this exciting program, and just teaching all over and now teaching with us. So very excited to have you. Thank you so much for your time again, and I'll be seeing you soon.
Yeah, of course. Thank you so much for having me. It's so great seeing you, and I'll see you very soon.